information today on a story we brought you last week. That's when Maine Family Planning said it might have to close its primary care service with the elimination of some federal funding.
Now, we're learning 3 locations will be ending that service. News Center Maine's Brianna Bush joins us with the latest tonight. Hey, Brianna.
Hi, Brian and Bailey. Right now, I'm here at Maine Family Planning in Ellsworth, and right now, primary care services are going to be ending come the end of the month. Now, leaders tell me about 800 patients will be affected. Here's more on what we know.
We are in an impossible situation.
Maine Family Planning says it's lost roughly $2 million in annual Medicaid reimbursement, prompting the organization to end its primary care practice in Ellsworth, Presque Isle, and Holton.
Without federal Medicaid funds, Maine Family Planning is no longer able to sustain our vital primary care practice.
Earlier this summer, Congress rescinded MFP's Medicaid funding through President Trump's budget reconciliation bill. The law temporarily blocks certain healthcare organizations that also offer abortion services from receiving any federal Medicaid reimbursements. However, the healthcare provider says federal funds cannot be used for those services directly in the first place.
We made this decision to protect access to a highly specialized form of healthcare that is even less available, being sexual and reproductive healthcare.
Director of Advocacy and Community Engagement, Olivia Pennington, says its primary care practice was modeled to serve Medicaid patients. About 800 primary care patients in its network will be affected. That's why the organization is working to make sure patients find access elsewhere.
Over the next 30 days, we're going to work really closely with our almost 800 primary care patients to help identify other primary care providers in their region who are accepting new patients.
The end of these services comes as the state is seeing a lack of healthcare access in rural areas.
To just cut services like this because of lack of funding is simply unconscionable, and people are going to get hurt from this.
While Maine Family Planning will no longer be providing primary care services,
we will continue to see all of our patients regardless of their insurance status, regardless of their insurance carrier, and regardless of their ability to pay for family planning services.
While Maine Family Planning Services will no longer be offering its primary care services, they still said that they're going to be offering its other Maine Family Planning Services at 18 of its locations across the state. In Ellsworth, Brianna Bush, News Center, Maine.